Uganda AIDS Commission has carried out a march to commemorate the International Candlelight Day, which aims to remember those who lost their beloved ones with HIV/AIDS and those still living with the virus.
And although we do not have a cure, we don't have a vaccine, but we have treatment for now. People who are living with HIV are able to be on life-saving medication. They are able to be productive and live normal lives. And our encouragement is that HIV is still here with us. There are still new infections. Know your status. Go out there and test and know your HIV status. If you're HIV positive, start on treatment immediately, because there are benefits to starting on treatment, what the WHO calls test and treat.
Uganda is on track to meet the targets. We believe that Uganda is one of those countries that by 2030 will declare an end to HIV and AIDS as a public health threat. However, the gains that have been made are very, very fragile. Very, very fragile, and they must be protected by everyone, not just government, but civil society, community leaders, and the population.
The Director General of the Uganda AIDS Commission, Dr. Nelson Musoba, says that 1.4 million Ugandans are infected with HIV/AIDS currently, noting that the government through the Ministry of Health is ensuring that this number is reduced through awareness and prevention.
Akakadde kamu mitwalo abiri kwabo bali ku ddagala bo bajja ne bakebeza ne batandika eddagala. Waliwo abalala mitwalo nga 15 kugenda mu abiri. Abamu bamanyi nti bakalina, abamu tebamanyi. So tulina okugezaako nga bwe tusobola tuweeyo obubaka tulabe nti buli omu ku ffe bwe yeekebeza n'amanya nti alina akawuka baveeyo bajje beekebeze.
When you look at these new infections, 20,000 of them were in young people. 15,000 of them were in adolescent girls and young women. And when you look at, when we analyzed the situation further, you find that these are mostly girls who have dropped out of school. They are vulnerable. They are facing gender-based violence, and they are also not accessing prevention.
On the US funding withdrawal that threatened Uganda's progress in HIV/AIDS fight, Dr. Musoba gave hope to Ugandans, noting that the government has succeeded in accessing resources to cover up the gap.
Although, for instance, the USAID structure is still under review, but the CDC, the Centers for Disease Control, which is an agency of the US government, is now the mainstay of delivery of their support. And when you speak to our USC government colleagues, they can speak to this more. And that is how part of but the second part, which is critical, which Ugandans need to know, is that government has moved and identified money and provided it to support those gaps. We've worked with the Minister of Health and the Minister of Finance, and they have identified part of that support. And in the new budget, we have assurance from government of Uganda that the gaps will be addressed, that there will be no gaps from ARVs and other drugs as a result of the US government policy review.
In 2023 alone, there were 38,000 new infections and 20,000 AIDS-related deaths. Young people aged 15 to 24, particularly adolescent girls and young women, remain the most affected demographic.